Welcome to Health Alert. I'm Pam Butler. Today we're going to talk about physical therapy and knee replacements. And joining me is Dr. Ken Randall. He's Assistant Dean for the College of Allied Health at the University of Oklahoma. Welcome to the program.
Well, thank you very much.
Now, before we begin our topic, tell us a little bit about physical therapy and how to become one, because the University of Oklahoma has a physical therapy program.
Correct. We've transitioned 3 years ago to the Doctor of Physical Therapy program, so it's a DPT degree, and it's a 3+3 program, meaning that our students will apply having 3 years or more of degree work, prerequisite work, and then 3 years with us in the actual program.
So when you say 3 years of other can you come from any other discipline into physical therapy to get this doctorate, or is there a physical therapy degree at the undergraduate level? How does that work?
Most programs these days are at the doctoral level, and you certainly could come with a bachelor's degree in some other area. The prerequisite work is very specific to chemistry, physics, anatomy, those types of prereqs that will prepare you for the curriculum in physical therapy itself.
Okay, that's interesting. So do you have many students that are returning to school from other kinds of disciplines and professions?
We do, actually. Some people who are changing careers. Certainly healthcare is one of those growing careers that I think there will always be a need for that as long as the baby boomers are aging and not taking as good of care of themselves as perhaps they should.
Okay, excellent. Now, what does a physical therapist do? Tell us about that.
Well, specifically, or actually maybe in general, physical therapists are movement scientists. We help people to move optimally. That could be in the context of walking, certainly in any context of doing a daily activity that is important to the person, whether it's work, hobby, leisure, whatever.
So with physical therapy then, like let's say if you're just going to be your recreational athlete and we
One
never
of those weekend warriors.
Right.
Yeah.
And we never stretch or do anything like that prior to. Seeing a physical therapist to get exercises for that, is that something that's going to lessen our capacity for injury before and after, or are we really, a lot of times people think of physical therapy as just as an illness-related phenomenon?
Right. Well, although people have many opinions about the current healthcare trends, one of the trends is towards wellness and prevention, and I think that's an area that physical therapy is going to be very helpful. So my hope is that yes, we will be able to work with people before they get injured to teach them appropriate stretching, strengthening exercises, conditioning exercises, so that when they do go out on the weekends to play some sport that they haven't played in quite some while, that they don't end up on the traumatic side of things and then seeing us as a result of an injury.
Okay, interesting. Now when we look at physical therapy, and let's start off talking about sort of knee replacements, and I know you have a picture here. With knee replacements, I mean, how young do physical therapists work with people with knee replacements? How young have you seen people have them?
The youngest patient I ever saw who had a knee replacement was in their mid-30s. And they had played high school football, had a number of injuries, actually even a fracture that caused premature arthritis to occur. And so in their mid-30s, they had their knee replaced. But you're exactly right, though, that for the most part, it's an older individual, somebody in their 60s, maybe even their 70s or 80s, who may have their knee replaced.
And I think that's really important to mention, too, because I wanted to ask that because my daughter had a traumatic knee injury in high school related to soccer. And in her 20s, there was nothing else that could be done. She ended up with a knee replacement.
Wow.
And that's something that you never, ever think of, you know, to be able to have a knee replacement that early. And believe it or not, she's in physical therapy. So
well, there you go.
But she went into that field. But that's something that, once again, proper conditioning, stretching, doing all those kinds of things may not prevent everything, but
certainly
it can certainly help things.
Oh, very much so, yeah. In her case, it may have been that she had an injury to a meniscus that
yes, she did. She did.
And having had that either removed or partially removed, suddenly that put more bone on contact with bone, which caused the arthritic changes that probably resulted in her needing the replacement.
Right, and it was most incredible, most
Yeah,
incredible.
yeah.
So then when we think of knee replacement, of course, we have a model here. Kind of show us what is the area. This is our knee, right?
Exactly. These are the bones and then some of the ligaments and the tendons of the knee itself. So here's your thigh bone, the femur, and then here's the tibia down here. And then this is your kneecap right under here.
Okay.
So in most of your typical knee replacements, the surgeon will remove both of the ends of the bone and replace it with usually a metallic prosthesis or an implant. And then maybe half the time they'll replace the undersurface of the kneecap, and then half the time they'll leave the kneecap the surface as it is.
Now, there are different kinds of materials they use for knee replacements. In terms of working with that, in terms of a physical therapist, you talked about the metallic type. I know there's ceramic, I believe. There's all different kinds.
Right.
Is there one that's a little bit different than another as far as the rehabilitation and how you work with it as a physical therapist, or does it not really make much of a difference?
As far as the actual rehab, there's really not much difference whether it's a ceramic versus a metallic versus a plastic implant. For the knee, most of them are still a metallic alloy. However, if they replace the patella, that may be the plastic component. But because there's a lot of weight that goes through those, typically it's the metallic implant.
Okay, now you mentioned patella, and some people might say it was the who?
The kneecap.
Okay, the
Yeah.
kneecap. Okay, so for you, it just doesn't make a whole lot of a difference which type is really used.
Correct. And most of the knee surgeries are fairly standard as well, where the physician will do an incision right along the inner side of the kneecap, and then move it aside so they can get to the bone. So that when somebody has a knee replacement, it's fairly telltale because they have this incision that goes just right down the front of the knee.
Exactly, exactly. Now with this, in terms of the knee replacement then, how soon, because you've got physical therapy, the hospital focus, you've got
Right.
it after that. In terms of right after the surgery,
Right.
what is the physical therapy, the rehab for that? Sometimes we think, oh, surely it doesn't start for a week.
I think most people would like that.
They would like
Yeah.
that, but that's not the case.
Yeah, depending on when the surgery was done, and most of them are fairly early in the morning that they're done, it could be that afternoon that a physical therapist may show up to help the person sit up at the side of the bed, maybe even walk a few feet. And then certainly the next day after surgery, we'll be working with them on regaining their mobility with transfers, and then again walking longer distances.
Okay, let me ask this question, because you mentioned about getting up, because usually if the surgery, of course, is that day and you're starting some movement, you have the luxury of the drugs.
Right.
You know, in terms of pain management and that
Right.
type of thing. There's this machine, and people may have seen the machine that, you know, is used, and it's like moving your leg
Right.
and stuff like that. Tell us about that, and is that a physical therapy phenomenon, or is that just something to just help start getting some movement, or exactly what?
Well, it's called a CPM, which means continuous passive motion, and definitely physical therapists or any of the healthcare providers that work with a person who's had the knee replaced will be putting the person on and off of it. And essentially what it does is it will passively move the person's knee into flexion and then extension so that you can regain and actually maintain range of motion. One of the biggest challenges with a knee replacement after the surgery is that because they do cut into the bone, there's a fair amount of swelling that happens around the tissues as well. So that swelling, you know, the knee is somewhat puffed up, and so it can get very stiff very quickly. And so
Okay.
mobility is very important.
Okay, so it is important to start that, because sometimes people think, well, that could probably wait, but it's really
Right.
critical to start that so that you can continue with some motion.
Exactly, and as you said, you know, the medications are there to help diminish the pain, but the person certainly is still feeling some discomfort, and sometimes they are hesitant to move. The thing that they learn very quickly, and I think the physical therapist will help them with this, is to realize that as they move, they actually feel less pain.
Okay, we're going to take a really quick break, Dr. Randall, and come back and pick up on some physical therapy in this knee.
All right.
All right, please stay with us. We'll be right back.
The 9/11 memorial is for my 343 brothers who didn't make it.
And for my brother. This shows the world that we can rebuild.
And that we are strong.
It's for the heroes like my dad.
This year, the National September 11th Memorial opens in New York City. Join us to honor, remember, and reunite. You can help right now by texting the word HOPE to 80088 to give $10.
Welcome back to continue our discussion talking about physical therapy and knee replacement. Joining me again is Dr. Ken Randall, Assistant Dean at the College of Allied Health here at the University of Oklahoma. Let's jump in. Now, with this knee, we talked about just right after surgery, you're going to begin some movement and using the CPM machine to try to help get the knee started so it doesn't kind of freeze up or make it a lot more difficult.
Or get stiff, yes.
Or get stiff. Now, how do you progress with this? Okay, you start with some degree of walking. Are there certain specific exercises that you're going to try to have the person do to target these specific areas where that's happened?
Yes. You know, as most people know, there are many different joints that can be replaced. The hip is probably the most common, and the knee, the shoulder, the wrist, etc. But one of the things about knee replacements is that swelling really is a great deal more of a problem with knee replacements than the other joint replacements. And so keeping the mobility is going to be very important. And you're right, exercise and just movement is going to be critical. The basic exercise of just straightening and bending the knee is a good start, but certainly we'll want to fold that into functional activities. And so one of my favorite exercises for a person who's had a knee replacement is having them just stand up and sit down, because it strengthens the quadriceps, which controls the knee movement, and it also, you know, allows them to get really good range of motion.
Now, with the knee then, are there certain things that, like with the CPM machine, it goes by different degrees or something.
Right.
Tell us a little bit about that. Like, what is the degree thing? How do you tend to start, and what's the purpose of it?
Well, if you were to take a protractor and measure the bend of your knee, with somebody who's had a knee replacement, we're looking at probably a goal of about maybe 125 to 130 degrees of bend in the knee. And so with the CPM, you will gradually work your way up toward that goal. Because of that swelling that we were talking about, you don't want to push it all the way to that extreme at the very beginning, you know, day one after rehab. So it's a slow incremental increase. And I think the other thing that I might mention is that there's been a fair amount of research on the use of continuous passive motion, the CPM, and what it tells us is that people who will move their knee do just as well without a CPM. But it's the people who are hesitant to move their knee that it's really helpful. So with your daughter being a very young, motivated individual who had her knee replaced, she might not have needed the CPM, you know, if she was just continually moving her knee by herself.
Right, and you do have to use it a couple times a day or several times a day.
Right.
It's just not a one-time thing. Tell people about that.
Yeah, you know, typically if they're laying down, they will be on the CPM. I mean, we're talking, you know, hours a day. But certainly they can be off the machine for a fair amount of time as well. But there will be a point, if the person's on a CPM, that they may actually sleep with the thing.
Right, and I know she had to do that, and some of it too has to do with, like you're saying, how much you're going to move, and we all have different pain tolerance levels.
Right, right.
So sometimes if your pain tolerance level is not quite as high, you may need more support with that, because you're not probably going to, it's kind of hard to make yourself hurt.
Exactly.
You know, you may be a little more resistive to doing that on your own.
Right. In addition to the medications that someone can take, ice is one of the best ways to help alleviate both the swelling and the pain. And whether it's an ice pack, or a lot of people who have knee replacements will have a cryo sleeve, which is basically a wrap that goes around the knee that has a refrigerant going through it that helps to keep the knee nice and cool.
Right, and she had that as well, which was really, really very helpful. Now with this, as you begin to, because sometimes people will talk about, like you say, going into physical therapy. So while you're in the hospital, you're going to be having the therapy on a daily basis. What tends to be the average hospital stay for a knee replacement and having the physical therapy?
You know, right now the average hospital stay is about 3 or 4 days. Now typically the person may not go home right after that. They might be admitted to a rehab facility. So it kind of depends, I think, on the preference of the physician who did the surgery. But yeah, typically 3 or 4 days is the maximum, whereas 10 years ago it might have been a week or longer.
Right, right, and she was in about 4 or 5 days because there were other issues to get movement going and
Right,
things such as that.
right.
And like I said, it kind of can depend, but that's on average. So when the person goes home, are they immediately given physical therapy in terms of you go into the physical therapy center, or can physical therapists come into the home?
Either one. And certainly it is a continuum of rehab right after surgery where somebody in the hospital will provide physical therapy, and then they may go to the rehab facility where another therapist may provide care for maybe 4 or 5 more days, and then the person will be discharged home. And depending on their mobility level and their level of independence, it may be that a physical therapist comes to their home and provides care, or the person may go to an outpatient clinic as well.
Now, are there other kinds of exercises that you help them with? For instance, sometimes we've seen sheets and things and towels, and you
And
pull and
plastic bands and
different
cuff
things.
weights. Yeah.
Tell us about those things, especially the ones that you can use in the home setting.
Well, certainly as the person gains strength and as their range of motion continues to improve, we'll be starting to work more on strength and endurance as well. And so adding resistance with the TheraBand, the elastic bands, or cuff weights, definitely will incorporate those as the person's able to progress and tolerate those.
Okay, now what if a person ends up getting into difficulty with scar tissue? How do you work with those individuals? Is this where it's just a lot more aggressive? Because, of course, sometimes they have to have a manipulation and they go back
Right.
in because there's been so much scar tissue buildup.
Right, and certainly scar tissue, it's our friend, but it's also something that we're always working against because that's how your body heals itself. The biggest way to prevent it is the mobility, early mobility, whether using the CPM or just moving on your own. But if the person hasn't been as mobile as we would like and they do develop stiffness, exercise can get at some greater mobility to an extent, but you are right, there may be a point where you do have to have a manipulation under anesthesia, and that's kind of the last resort.
Okay, and then after that point, physical therapy is a lot more aggressive, is it not?
Yeah, you really kind of just restart all over again with the range of motion, perhaps the CPM, but certainly, yeah, the person will have to be much more responsible for moving and not getting stiff again.
Right, because once you've had that level of scar tissue, even with the manipulation, you still have an equal risk of building it up again.
Well, the manipulation itself will have introduced some degree of trauma, and so the body will begin to reheal itself, and it will lay down more scar tissue. The good news is that a person who has to go through a manipulation, they realize how much work they need to put into the rehab to avoid having that done, and they're very motivated to do so.
Exactly, and I must say my daughter had to have the manipulation.
Oh, wow.
Because she had some real difficulty with movement and things such as that, although you wouldn't think she would, being an athlete, but
Right.
with all of these other things factored in and the pain level and different things like that, it was most challenging,
Yeah.
most challenging. And you're right, after that manipulation, it really kicks in with, I've got to do more no matter how I'm feeling,
Right.
and maybe get a better pain management going, because sometimes you might need a little bit more than someone else needs to control that.
Right. Certainly, every person has their own unique needs, and some people just scar more than other people do, and that makes it tougher too.
Right, and I think too people should realize that if you're on pain medication, sometimes people are like, I don't really want to use it because I don't want to get addicted.
Right.
Or you're not going to get addicted if you're using it appropriately
Correct.
for what the reason is, you know.
Very much so.
So you need to use it and use it properly, keep the pain under control,
Right.
so it's easier for you to do the movement.
Yes, I think the combination of the right amount of pain medication, and you're right, the person won't be over-medicated by the physician, with ice or the cryo sleeve and exercise, whether it's the CPM or actual just moving on their own. Those three things are really going to help the person to rehabilitate and recover their function without a great deal of discomfort. You know, I think one of the major points about a total knee replacement is that leading up to that point, the person had a lot of arthritis, which was quite painful.
Exactly.
And so most of my patients will tell me that their knee hurts less after having had the knee replacement because that arthritic bone has been replaced.
Exactly. That is a very good point. We're going to take another quick break and come back and finish a few more points.
Sounds
So
good.
stay with me, and you stay with us. We'll be right back.
how to kickflip 6 stairs takes determination. So will getting into college. I've got what it takes. So do you.
Welcome back. To complete our discussion talking about physical therapy and knee replacement, joining me again is Dr. Ken Randall, Assistant Dean at the College of Allied Health, the University of Oklahoma. Let's jump in now. Now, I wanted to ask you, because we're talking about sort of some, manipulation and other kinds of things that could possibly occur if there's a lot of scar tissue buildup, and it can be built up for a number of reasons. It can be either, or a combination, because some people do scar a lot more than others, and sometimes persons of color do scar a lot more and create more scar tissue than others. So you're having those factors to deal with. I want to ask you about this other, because unfortunately my daughter had that too, where she had to go in and she was working with physical therapists and go into the center, and actually they shocked the muscles and things like that. So tell us about that.
Well, at this point, whoever is watching may be very worried about, thinking, I don't want to have a knee replacement. So
no, but hers was more of the exception versus the rule.
And certainly as we're thinking about the stiffness and the manipulation and then potentially the electrical stimulation, I mean, we're talking, maybe 1 or 2% of all people who have knee replacements. But yeah, the electrical stimulation is a way to really just help the quadriceps muscles, the muscles of the thigh, to contract more strongly to get greater mobility.
Okay, now with this, is it because the muscles have gone to sleep more? Is it because they're really not being exercised to the level that they should? Is it a combination?
Yeah, they might have atrophied from not as much use, for the person not moving as much, but it's also possible that the swelling and pain in the knee itself may be inhibiting or causing the muscle not to fire as readily as it might do if the person wasn't in pain.
Okay, and it really wasn't a painful process. Kind of describe to our viewers, if you happen to be that 1 or 2% like we were, what to expect.
Yeah, the good news about electrical stimulation is that the technology these days makes it very as comfortable as electrical stimulation can be. But it doesn't feel like a shock that would be uncomfortable. If anything, it's just sort of a mild tingling sensation that again helps to stimulate the muscle to contract more strongly than it would on its own.
And at the time that she had hers, you just go in and you lay down, and then they put the electrodes on and hook you up to a machine. And like I said, it wasn't an overwhelming, painful or discomfort kind of thing.
Exactly.
But helpful. Now, how often would you tend to need to have that? And I won't talk about what she had, but in general, if you have to do that.
Right. I would tend to say that at the point where the patient is able to really start moving their knee on their own, I would say that a good physical therapist would start backing off on using the electrical stimulation and rely more on the body itself to continue regaining strength and mobility. So I would hope that no more than maybe 1 or 2 or 3 sessions would get that.
Right, and I said I wouldn't say, but she had about 3.
There you go.
Now with that, there were other exercises that for sure got added to help really strengthen that area. Tell us about those types of exercises.
Well, certainly increasing the degree of squat that a person might do, and what I mean by that is, going from sitting to standing or standing to sitting is a bit of a squat in and of itself. But you might work with the person on squatting lower, so that if they needed to pick something up off the floor, that they could get enough knee flexion to do that.
Okay, yeah, and that, believe it or not, is a lot more difficult when you've had that kind of surgery than what we tend to think of. We do it so normally otherwise.
Right, we don't think about it.
No, we don't think about it, but then when we have to think about it and do it, it becomes actually a lot more.
Very much so.
Now, we've seen in physical therapy these balls, these great big balls and things like that you can sit on and you can lay on and you can do all kinds of things. Are those helpful at all in the rehab of the knee, or not really?
Probably less so with the knee. Whether you're sitting on the ball or using it to maybe strengthen your core muscles, your abdominals or your back muscles. With a person who's had a knee replacement, very likely they won't be finding a physio ball in their rehab unless they're really needing to work on their core strength. You might have somebody who might need a bolster, more of a cylinder that you might put under the knee to help facilitate the isolated knee movement. But for the most part, yeah, you probably won't see one of those big balls rolled out too much for a knee replacement.
Okay, and that becomes the sort of the home warrior. That sometimes when they get home, if they have those things, they think, well, if I sit on that and I'm moving around, then surely that's going to help. But that really isn't compared to what's specific, because, you know, we will modify things.
Exactly, yes.
But that's not a modification we should do, because it really isn't helping that much, other than core strength.
Exactly. And hopefully the physical therapist has also done a very nice job of teaching the person as they're going home on the different exercises that they should be doing and how to progress, even once they've been discharged.
Now, in terms of physical therapy and this rehab, once the person sort of gets back to where they were, you know, with movement, etc., are there certain types of sports or things like that that would be more helpful for them to kind of maintain that level of strength and continue the health of that in a rehab kind of phenomena?
You know, really it's almost depending on what the person would like to do, with one sort of caveat, if I will, and that would be that any kind of repeated weight bearing, such as jogging or running, is going to be very difficult on that prosthesis, and it could cause it to wear out a lot faster. Most total joint replacements, 10, 15, maybe even 20 years may be the lifespan of the prosthesis, but certainly if you do a lot of repeated activity like running or jogging, that could decrease the life of the prosthesis. So something like bicycling or swimming would be a wonderful activity that will get at the aerobic and the strengthening elements that you're interested in without the impact on the knee joint.
What about the elliptical? Because we've heard a lot about ellipticals compared to the treadmill or things like that. Is that a good machine?
That would be a great one, because again it decreases the impact or the loading that you would get from a step on a treadmill. Stair steppers are also fairly good as well, because you're not pounding the knee so much, you're just moving it.
Okay, now what about if you're excuse me, in the gym, and you know the machines where you sit down and you are lifting your
like the leg presses, or,
and you
or
have
the knee raises,
the little weights. Is that too much for that area, or is that a good thing?
You know, I think as the person has essentially fully healed from the surgery, which would be maybe about 2 to 3 months after the surgery, if their strength is enough where they can do that probably will not be as much of an issue.
Okay, so in time that could be a helpful.
Certainly, but you don't want to do that your 3rd week after surgery.
No, you do not, and I don't think the pain and all that would let you anyway.
People have pretty good common sense about that.
However, there are some people that may think this is a challenge. I think I can do it. So caveat, don't do that without your doctor's permission and working with your physical therapist.
Exactly. In physical therapy, the adage, no pain, no gain, is not something we work with, because pain is a good way for your body to tell you you're pushing too hard, you need to back off a little bit.
Excellent. Thank you so much for joining me.
You're very welcome.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me at YouTube at youtube.com/Health Alert USA. Take care, and remember, physical therapy actually is not just for knee replacements. Get the support you need and know how to move properly so that you don't damage what you don't need to. Take care.